As I started to get into kind of building out this three-prong model, separating out what a patient mindset is versus consumer, I had to invent a word to really describe the entirety of the equation here. And the word is patiented, right? So I think the US healthcare system wasn't built to be consumed, it was built to be patiented.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Welcome everyone to the PQS Quality Corner Show. On today's episode, we are talking about patient perspective and the evolving pharmacy experience. This is a topic that I love because evolution and change, whether it's in business, whether it's in patient care, whether it's in the patient experience, these are all natural. And our pharmacy profession is changing. And at least from my perspective, who better to direct those changes than the pharmacist, the frontline pharmacist, and the patients that we are providing services for. Now, I'm your host, Nick Dorich, and I'm happy to have on the show today, Scott Pope. For our team at PQS, we've known Scott for quite some time, but we are excited to have him as a guest on the Quality Corner Show for the first time today. Scott, he is the CEO and founder of CareerScript, the first career decision intelligence platform built exclusively for pharmacists. Now, Scott, welcome to the show, and how are you doing today?
Nick, thanks so much for having me on, buddy. Always a pleasure to get to visit with you, and you've had some really remarkable guests on the show. I'm honored to be included in the on that category now. Thank you.
Excellent. Yeah, we're really excited to have you here, and we've known each other for a long time, Scott, and it was really actually a pleasure for me. I think it was literally 3 or 4 months ago, got a tap on the shoulder. Hey, Nick, we were at the NASPA meeting, and that's the National Alliance of State Pharmacy Associations. Scott, you had a chance to come up and say hello. You were actually going to be presenting a session at that meeting, and that was actually one of my favorite conversations of the weekend, both the one that you and I had directly, but then your talk for the entire audience. And it was something that was very unique compared to a lot of the other conversations and meetings that I had at the APHA meeting and the NASP meeting. Because at those meetings, we're often talking about provider status or how we as pharmacists bill or, hey, this new medication or what we're doing. But this conversation that you had was really talking about evolving the pharmacy model and the idea of the patient as a consumer. So can you give us a little bit of an introduction to this concept before we get into our discussion for today?
Yeah, absolutely. Happy to do that, Nick. And it was fun getting to run into you at that NASPA meeting out in Los Angeles. The way I got teed up for that was I was asked to actually speak about how the digital pharmacy world is evolving. And instead of talking about how like the kind of the blocking and tackling of how that digital pharmacy is delivered, I went about it at the consumerism level. And I've really gotten some rave reviews about the way I approach that conversation. And I can get a little bit long in this because there's so much to unpack here. So I'll try to be pithy on this. I frame this conversation up in three buckets. One around knowledge, the second around finances, and the third around experience. So as I started to get into kind of building out this three-prong model, separating out what a patient mindset is versus consumer, I had to invent a word to really describe the entirety of the equation here. And the word is patiented, right? So I think the US healthcare system wasn't built to be consumed, it was built to be patiented. And when you start to get into these three different components, it starts to make a little bit more sense. So on the knowledge side, a patient mindset, right? So patients come in generally underinformed. In fact, the reason that they come to the healthcare ecosystem at all, physician, pharmacy, et cetera, is they're looking for answers. They're looking for a diagnosis. They're looking for a cure. They're looking for a product to solve whatever's ailing them. And so that's the balance of knowledge there exists where they're coming in underinformed. They're also spending, by and large, someone else's money, right? They have a deductible or a copay, but the majority of the financial burden is falling on the shoulders of their insurance company, by and large. And because of those first two things on the knowledge and the finance, they're willing to accept a kind of a lackluster experience compared to every other facet of their lives that they operate in where they are, in fact, consumers. So take off the patient hat and throw on a consumer hat. Consumers are coming in hyper-informed. They're getting information from the internet, from AI, from friends, from neighbors, et cetera. They're coming in with a, kind of an informed opinion on what's going on with them, perhaps even what they think they need to be treated with. By and large, they're also spending a lot of their own money in these equations. The rise of high deductible health plans, the rise of ICHRAs, I think on the horizon here, to defend employers from increasing healthcare costs, are going to make consumers spend more and more of their own money deeper into the year for those healthcare expenditures. So spending their own money, coming in hyper informed, they're consumers now. They're not willing to accept lackluster experiences. And in fact, if you treat a consumer poorly, you probably don't get a second chance to do that. And they'll shut you out and write scathing reviews on everywhere from Instagram to Google reviews to Reddit, et cetera. And so that the polarity between those two, when you look at for an independent pharmacy or a retail pharmacy market, you've got 5 people online. Some of them are wearing a patient hat, some are wearing a consumer hat. And man, it creates a really difficult tension there for pharmacists and pharmacies going forward. But I think that vernacular alone gives you an infrastructure to kind of work with. And it can, is the foundation here for the rest of our conversation today.
Excellent. Appreciate that introduction, Scott. And to me, it's so important because we often, and I don't know how many times I've been at a conference or an event or even going through pharmacy school where you hear it where it's, oh no, it's your patient. It's your patient. We think about it with that patient hat, but we do have to recognize that in these situations, the patient has the autonomy to choose what pharmacy and what pharmacy experience they're going into. So it is a blend. When we're providing the care, yes, they are a patient, but there is a patient-consumer blend that goes into it. So I really appreciate that conversation, and let's dive into it for today. The first question that I have, this consumer experience, it is changing all around us. It is becoming more digital. It is becoming more direct to us. It is being advertised to us, not just in healthcare, but all the ways in our own personal lives. We see this happening in other industries, and of course, we see it in our personal lives and how we are reacting. How is the consumer experience already changing in pharmacy? And can you give us some direct examples that are applicable today?
For sure. And it's a great question. I think the most the glaringly obvious example, currently at our doorstep right now is the one manifesting around retatrutide. For those of you that aren't familiar with that drug name, you can find the spelling in the show notes. That is Eli Lilly's investigational GLP-1, so still in clinical trials. And yet, despite the fact, Nick, that it's still in clinical trials, it's widely available to consumers through non-traditional channels, including at least one that hit my Instagram feed last June of 2025. The peptide company advertising retatrutide to me had a little box at the bottom of the order that made me attest to the fact that I was a laboratory and I would not use the medication for human use. Wink, wink, right? And so when you check that box that this is for laboratory use, not human consumption, 3 really important things go away. The FDA doesn't regulate labs. The requirement for a prescriber's prescription, because it's not going into a human. And when there's no prescription, there's no pharmacist check. And yet consumers are going after retatrutide with reckless abandon right now. And so when you imagine a scenario where, a consumer walks up to a retail counter asking about retatrutide, the pharmacist, who's a highly valued necessity in a patient's mindset, quickly becomes the gatekeeper in that consumer's perspective. And that consumer economy will reward the services that are advisory and help them convert their knowledge into wisdom. And I use this example out in Los Angeles there at the NASP meeting too. When you come in hyper informed as a consumer, you're coming in with knowledge, right? And not necessarily wisdom. And the difference there, knowledge is knowing that a tomato is a fruit. Wisdom is knowing it doesn't go in fruit salad. And then I like the third leg of philosophy is contemplating if that makes ketchup a smoothie. But those are the services consumers will really value in that scenario. But otherwise, you can quickly become the face of a gatekeeper, and we certainly don't want that for pharmacists in any capacity. But what that requires is that pharmacists to get further upstream in the care delivery process well before the kind of the final check on the accuracy and appropriateness of any given prescription.
Yeah, this is the fork in the road that we have, Scott, is that these models are changing, and pharmacy can be, and the pharmacy team members, the pharmacists, the technicians, the healthcare providers, we could be seen as a barrier for this, or we have an opportunity to adapt and to adopt appropriate models. I know, as you were kind of talking through, and for some of these models, they get around what are seen as typical traditional items. We don't necessarily want to do that, but we do need to have a change here that does come around. So with that being said, can every pharmacy look at making this own shift for consumer-driven care models? Is this something that, hey, does a pharmacy need to have an approval from a board of pharmacy, or is this really an item where pharmacists can take their destiny into their own hands to better reach the patients that are in their community, in their sphere of influence?
Yeah, another good question, Nick. I'm very bullish on this, and I firmly believe pharmacies and pharmacists will continue to be a very essential component of the healthcare ecosystem. How valuable they are in that is, I think, depends a lot on how they perceive their own value in that shifting landscape. Rest assured that this this is not the time for stoicism. It's absolutely the time for intense evaluation, assessment, evaluating ways to deliver high quality services that consumers value. The pharmacies themselves, it's an imperative for them right now to do that self-reflection, to really do that deep dive, that deep introspective look into those. And we can get into a little bit more if you want to go down that path, more specific recommendations. But I also think pharmacists need to do that same introspection. I mentioned this isn't the time for stoicism. I believe that the successful pharmacies and pharmacists in this next chapter of healthcare will be the ones that rise to the occasion with great intention and not just casually coasting through the waves. This is a storm phase of the Renaissance that we're in, and rest assured, it will sink some ships. And those that navigate it successfully will have done so on purpose, not just by happenstance. For pharmacies, again, looking at those service lines, the consumer needs, demands, looking at profit margins, feasibility studies. Again, happy to do more detail on that in a moment. But for pharmacists, when you're looking at your career, we've historically been forced, and Nick, you've kind of weathered this firsthand too, to navigate our careers using very generalist resources. Things like personality tests that are maybe Myers-Briggs or Strength Finders or even CCT in some scenarios that are trying to guide us towards where we're a great fit for the healthcare ecosystem. And while those tools have their own merit, they're not really tailored in any capacity to a pharmacist mindset, to the healthcare career landscape, how consumerism and AI and automation are reshaping those career paths going forward. And so many pharmacists will need to stay in traditional roles on a go-forward basis. They'll just need to find ways to evolve inside of them. But then I firmly believe there's another cohort of pharmacists that need to find new career pathways in this new landscape that are better suited for their gifts. And fortunately, you mentioned where I'm sitting now at CareerScript. We finally have a platform that focused at pharmacists that gives that really deep introspective insight that's aligned with the available career pathways and the predicted evolution of those. Understanding how you fit in that ecosystem, given your skills, your gifts, your background, your future aspirations, hopes, and desires. And CareerScript even helps you take that next step of what to pursue next. For some pharmacists, it may be as simple as a certification or seeking a promotion, or for others, a completely new career direction. What's fascinating, though, is for a profession that is deeply and intensely in love with information, far too many pharmacists make these really critical next steps in their career with a complete absence of information. And that's a gap that CareerScript's really trying to shore up.
The example that I use here, Scott, and this we'll say historical tale. There are many believe it to be somewhat a false quote or how actual the story is. But Henry Ford, right?
Yeah.
Maker of the automobile, right? when he was out there and selling the first automobiles, he gave the story that, and again, whether or not this actually happened, or many believe this to actually be a false quote or a myth, but what he said is that he went to investment bankers, and one of the investment bankers told him, well, we don't want this. What people want is a faster horse, and that's going to be a business that lasts forever. This car is just going to be a fad. I point it out because we now, in the year 2026, if this investment banker quote was actually real, we now look back and see how out of place that was, and where that wasn't meeting the consumer where they want to be. Pharmacy, I think we are in that same position. Do we want to be in the position of the investment banker that's betting on the horses as the form of future transportation? Or do we want to bet on what is the future? And in this case, I'm talking about, do we want to be a pharmacist? Do you, listener, do you want to be a pharmacist or pharmacy technician that goes the way of the horseshoe maker and the cobbler or do we want to be those that are involved with building the new car and building the future? That's the position that we find ourselves in. So with that, Scott, how quickly and how can pharmacy staff, how can they shift their space? How can they shape their operations to a modern and more technologically advanced care model to meet patients and meet the consumer where they want to be met?
I love the way that you incorporate the word modern. One of my favorite books about Henry Ford is I Built the Modern Era. And as a really kind of fascinating guide of all the inputs he had into modern culture, everything around the work week to unions and beyond. He was really quite the innovator. He certainly had his social shortcomings, but I love that you worked the word modern in there around the technology. I think when you look at the technology that exists today, I don't think the speed to adoption is going to depend on the technology per se. I think it's more on the pharmacy's willingness to take that deep look inside themselves as to where they sit today and what role they want to play in the future. Going in depth into kind of service line audits and doing some very specific accounting on where time and labor go and what talents and skills they're uniquely positioned to be able to deliver, where they make margins, what their consumers, and very intentional word there, value. There's certainly things that those pharmacies do, with technology that are, part of habit or regulatory requirement those regulatory need to stay in place. But I've seen very few pharmacies kind of look with deep intention as to what they need to become in the future. I don't think they need to throw the baby out with the bathwater, though. I think there's some, the way that this change happens is gradual. It's not in a single leap. It's one service line at a time. I think the Plan, Do, Study, Act framework is great to adopt here. Go pick one consumer-facing line, medication therapy management, some type of paid advisory offering. I firmly, and I've spent a significant amount of time in the concierge medicine and direct primary care space. I think there's some very instructive lessons there that when consumers are faced with the opportunity to spend their own money on something they see valuable, there's disposable income there that they're willing to spend. But the rate of adoption of technology, it's just going to depend on what that pharmacy wants to build and where they're trying to become, because I don't see technology being the rate limiting factor here. I think it's the intentionality with what the pharmacy wants to be as that limitation.
There's, I think, very much a mindset approach, Scott, and another famous quote, typically you can go fast or go alone as it goes. And it's often viewed as a dynamic. You can go and do things. You can move along, or you can build consensus for what you need to do. There's also another element for many of us in pharmacy. We are trained to, right? And Scott, it's been a while, I think, since folks like you and I were double or triple checking a prescription on the front lines of the pharmacy, right? But I bring that context up where for many pharmacists, perfection is the only way. And when we're looking at these new and evolving business models, doesn't necessarily need to be perfect. We need to make sure that we're maintaining HIPAA privacy and those considerations that are there. But we do need to give ourselves that grace to adopt a new model, and it's going to continue to change and evolve and how those things are going to be set. So at some point here, it becomes simply for the pharmacy, change the business model. We need to make the change. It does not need to be perfect. It's probably okay if it's not perfect, because you know what? The model that's perfect today is not going to be the model that's perfect tomorrow. So continue to change, continue to evolve.
Yeah,
All right, Scott, with that, I do have a final question for you today.
sure.
And we've talked about the impact for patient care services and what the patient, or again, the consumer, what they are seeking. What I haven't asked about, though, and you started to allude to this already with the work at CareerScript, but with these changes in models, what does it actually mean about the impact and the satisfaction, and dare I even say the joy, for the pharmacy staff? How does this type of modernization impact the actual pharmacy staff?
Yeah, well, and you kind of touched on a little bit there, Nick, as well, right? I think as the pharmacy's responsibilities in this ecosystem shift, so will the skill sets that are demanded of the individual pharmacist and pharmacy technicians. The act of flawlessly filling a correct prescription every time, I think, is going to remain non-negotiable. Those are the difficulty there is the things that we've done historically are just going to become table stakes. They're no longer differentiators for us. But the differentiators going forward are the ones that are able to translate into meeting consumer needs and demands in a way that they see as valuable. And that's a very different skill set than where a lot of the current pharmacy staff are operating. For some, they've been behind the counter begging to be out in front, to be having conversations with patients for years, and have just never been afforded the bandwidth to be able to go do it. And so that can be very energizing for them to contemplate doing that. For others, man, it can be completely debilitating to think about coming out and having a conversation that is informative with the public, taking what they think is hyper informed knowledge and explaining to them from a wisdom perspective where they've got things wrong. Man, that will cripple some people. But when we talk about pharmacies needing to have that self inspection, I think pharmacists need to do that as well, understanding where their strengths sit in the landscape. What part of this new shift is something I'm really good at and I can grow into, or perhaps there's skill sets that I'm going to need to build very deliberately to remain relevant in this space going forward. Now, I think, again, much like the pharmacies, having the pharmacist having that very difficult conversation with themselves is important. And frankly, it's not something most pharmacists have even had a structured way of approaching, which is another meaningful way of why I think CareerScript even exists today. The modernization happening at the pharmacy level is also happening at the individual career level, and they're just at different scales. And I'm thrilled that CareerScript can help individual pharmacists navigate the future for their career, because I firmly believe, as much as the PharmD degree is not a destiny, I think it's one of the best degrees to have in healthcare. And I want people to stay engaged and encourage friends and family far and wide that this is a great career path to have. And there's really positive things on the horizon.
It often comes down to a situation, Scott. We see this where, for lack of a better term, that there is chaos in the pharmacy space, in the pharmacy world, as it is. And chaos is not inherently a bad thing. It is a time of change. But with that does come an opportunity to forge a new path, a path that was not there previously, a career opportunity, a type of pharmacy that will at some point in time become the norm or the standard. But that's how I look at this, where these changes, they're not inherently good. They're not inherently good, or they're not inherently bad. They are just different. And change is going to be something here that is different. It's what each of and every one of us does as the pharmacist, as the patient, as the consumer, how we find our own satisfaction in it, and how we work to be responsive to our patients. Because end of the day, for me, I want to be a pharmacist, and I think many of our listeners, whether they're a pharmacist or a pharmacy technician or whatever it is in the pharmacy space, where we get the most joy out of this is really getting to help patients and doing it in a way that is most meaningful to the patient. So as the environment changes and as different generations age and are taking more of the medications, coming to seek their pharmacist, it is natural for us to also look at what changes we need to make to face the differences for this aging population. And the more that we can stay aligned in that regard, I look at it as a that lends itself to a better experience and also goes to make it a more meaningful work experience for us and for our pharmacy team members. So, Scott, with that, I said that was our final question. Technically not true, but that was the final question of our main discussion for today's episode. And I definitely appreciate your insights. I hope our listeners get a lot of great information that relates to it. But I wanted to give you somewhat of we'll call it an open mic here as we finish up. Are there any final thoughts that you have today that are maybe related to this discussion, or just more broadly for our pharmacist and our pharmacy team member audience, that any other messages that you'd like to share, information or resources that you'd like to point people to?
Yeah, absolutely, Nick. I really appreciate the opportunity to be your guest and address your audience today. It's always fun having a conversation with you. In my core, I firmly believe there's really, really good things on the horizon here for healthcare, for pharmacies, for pharmacists, pharmacy technicians, I think for the lot. But I think only the proactive will be rewarded. This is the time to grab the bull by the horns, to take intentional action, like today. Like as soon as this podcast ends, go take action, whether it's to fix, to work on things with your pharmacy, to work on things with your career. Do it today. In this landscape right now where we're at, I believe the word delay might as well be a 4-letter expletive. And so I just encourage people to, not waste another minute.
Not applicable to the pharmacy part of it, Scott, but I have been delaying my start of relearning Spanish as a language. And I think that is my kick in the rear to actually start doing that today. So I'll message you later to confirm that I've actually got that part started. I've got some travel that I'm looking to do later this year where I need to be at least be proficient in Spanish. And it's absolutely right on reminder.
I'll go one step deeper, Nick. I'll put a reminder in my calendar 2 weeks from now to reach out and check in on you to see how your progress is going.
Accountability. I love it. All right. Now, Scott, with that, you shared a lot about CareerScript. You shared a lot about this evolving model and the things that you're doing. I'm sure folks are going to want to ask you questions or find out more information. So with that being said, where can they find you? Are there places they can go to look for more information, or what you've been sharing about, or if there's a way that they can contact you, what's the best way to do that?
Sure. Easiest to contact me directly, info@careerscript.com. That's our website is careerscript.com. We're on LinkedIn, Instagram, Facebook, are the kind of the social media channels that we're on. But info@careerscript.com will get forwarded directly to me.
Excellent. All right. Well, Scott, again, thank you for joining this episode. As I shared at the beginning, it was a nice surprise to reconnect with an old friend and old colleague at the APHA and at the NASPA meeting. And that really changed a lot. I think it was one of the most meaningful conversations that I've had in this year, and has made me think a lot differently about my interactions with pharmacists and pharmacy team members, and whether it's day-to-day type of items, or even as I think about our work here at PQS. And I really wanted to bring that conversation. The more it was sitting in my head, the more I wanted to share this with the broader audience. So I immensely thank you for joining and spending some of your time today with us to share those thoughts. So folks, go check out CareerScript, connect with Scott for more information. But with that does get us to the end of this episode. So we hope with that you enjoyed this episode of the Quality Corner Show. And before we go, we have one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes. And we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.